Hello and welcome to this presentation of pain in chronic fatigue syndrome, the 3 steps way to resolve it. Who suffers from chronic fatigue syndrome pain wants it to be gone. We want to be able to take care of ourselves, do therapy, get out and about, waking up, refreshed and have energy for all day long. We want no further delays, feel our strength returning and do more things in our lives. I'm going to teach you this by showing you the way we understand pain is wrong, why pain should not be fixed with toxic chemicals, and the natural way to approach and treat pain. Here is what you learn during this presentation. Why pain occurs so you can prevent it, how to see a solution where others see a problem, the way pain reveals itself on the body so you can see which kind of functional problems you're dealing with, the 3 steps way to resolve pain so you can start today to recover. Please let me introduce myself. My name is Tommaso Perego and I'm a researcher and therapist in natural therapy for chronic fatigue syndrome based in London, UK. I regularly lecture at College of Naturopathic Medicine in London and other institutions. I practice in London and online and have clients in UK, Europe and USA. For the past 4 years, I've been researching chronic fatigue syndrome and helping people suffering from it, achieving excellent recovery results with my clients, gaining in-depth experience, and I want to share this experience with you today. If you have pain, you might have it at times, you might have it at all times. Pain can be at different intensities, the location is multiple and sometimes unpredictable. The quality, the sharp, burning is deep, is mostly deep and diffuse, but might vary a lot as well. In the past 3 months, I had 3 current cases in which pain at high intensity was gone within a week of treatment. For one client, female, 50 years old, pain has gone away almost entirely now that they are on week 11 of the treatment. For one other client, a female of 40 years old, pain has returned on the 3rd week in a milder form, but constant. We are monitoring the progress. For one client, male, 22 years old, pain has returned when they had fallbacks in the diet and lifestyle. We treated it again and it is gone again in 7 days. What are these 3 cases teaching me? That pain is dependent by the changes we do in our fluids. That pain can be diminished substantially in its impact without using drugs. That pain could be resolved in different types of people with different bodies with different needs. Imagine you're a swimmer and you're swimming fast and smoothly across the waters. That is because the waters are nice and clean in a nice temperature. I will use the image of the swimmer to present the analogy with our body. Our body is made of fluid. 83% of the brain is fluid. 83% of the kidney is fluid. In the lungs, the 85. The blood is 94. Our eyes, 95%. In these slides, we can even go a little bit more in depth. For example, if you look at this yellow part, the fluids are the ones that are in the yellow part and inside the orange part, meaning that the fluids that are called the interstitial fluids in between the cells and the vessels, and the ones that are inside the cells. So imagine you have a body full of fluids, and as a swimmer, your body will work fantastically if the waters are clear, nice, the right temperature, the right quality. But now imagine if the waters of your body will be something like this. Would you be able to swim as fast, as nicely? Would you not be very in trouble, very fatigued, find it hard, and maybe be in pain in your attempt to swim through it? So these 2 pictures serves me to give you an analogy of what is the problem in chronic fatigue syndrome. Unfortunately, we haven't noticed in our life that we develop this type of waters on the left-hand side rather than the right-hand side ones. Let's look at the scenario that is presented to people that suffer from chronic fatigue syndrome and pain in chronic fatigue syndrome. They go to the GP, and the GP offers them 3 different options. Option 1 is the rheumatologist, the cardiologist, the neurologist, the infectious disease expert, the endocrinologist, the hematologist, to do all the possible tests to try to understand what's going on with your body and why you're in pain. When that is not successful, many times you are referred to the early arthritis expert. So you look into further tests like the blood count, urea and electrolytes, full autoantibody profile, anti-nuclear antibody, extractable nuclear antigen, and so on and so on and so on. Or you go to the CFS specialist. So you look at more the thyroid function, the calcium levels, magnesium, vitamin D levels, low dose beta blockers recommended to you, and some physiotherapy, etc. Are these three methods working? The first approach is just confusing. There is no aim, no direction. It's like, let's look what you got because we don't know. The second is a recipe for financial disasters because going through all those tests is such an expensive feat. The third is not resolving the issue because it proposes damage limitation most of the time. So don't move, don't do too much, or suppression of symptoms. Pain, heat, redness, and swelling, so dolor, calor, rubor, and tumor in Latin, are the classic manifestation of the inflammatory process. Abnormalities of the joints, of the spine, associated muscle, tendons, ligaments, and bone structural abnormalities can all result in pain and need for neurosurgical consultation, but typically patient will not require immediate surgical intervention, particularly in chronic fatigue syndrome. And therefore, they require treatment to reduce pain and enhance the quality of life activities. So what are the common methods for treating pain? The suppression of the local mechanism of alert. They make the area numb. They suppress the general mechanism of alert. They make you numb. So if you have spine pain, they can give you the NSAIDs. And the consequence of the treatment is that you can develop gastritis, infection, heart problem, mood changes, depression, low energy, fluid retention, and osteoporosis. You have inflammation, arthritis, or IBS in your bowels. They use corticosteroids. And as a consequence, you can have fluid retention, mood swings, memory problem, behavior, upset stomach, and weight gain. If you have fatigue, muscle tension, sometimes they give you antidepressants. And then you have problems with feeling agitated, shaky, anxious, feeling and being sick, having diarrhea, constipation, dizziness, having also panic attack. So all the consequence of those treatments I highlighted in bold, they all are symptoms that are found in people that are suffering from chronic fatigue syndrome. Mood changes, depression, low energy, fluid retention, upset stomach, weight gain, anxious, sick, diarrhea, constipation, dizziness, insomnia, and feeling very sleepy. Going back to the analogy of the fluids, the swimmer in nice clear waters and the swimmer in mud. Conventional treatment, whatever it does to the pain, it could be beneficial because it's a strong, potent chemical action. What they do instead on the fluids of your body is this. They become more toxic and unable to clear of the constant intake of toxin coming from the chemical waste of the drugs. After 3 weeks, your fluids are a little muddy, but then in 12 weeks of a treatment such as antidepressants or NSAIDs, you will end up to have these problems in your fluids on top of your symptoms of exhaustion, fatigue, and pain. So I have some questions. Is it possible to resolve pain without creating further intoxication of the fluids? Are there remedies that can help change the fluids in such a way that the change is beneficial to the tissues, the organs, and the whole body? Yes. Let's look at the problem from the holistic physiology perspective. And here you are with the 3 points to overcome pain. First, most people currently suffering ME and chronic fatigue syndrome in my therapeutic program are power machines. What do I mean by that? This triangle represents the body assessment of different clients. The different colors suggest different imbalance. And in dryness, tension is the yellow, green is the dampness and stagnation. And the red one is instead signs of hyperfunction, that the body is pushing real hard to try to achieve something, but with no success, resulting in pain, inflammation, redness, etc. All of them, they have signs in the bottom right corner of the triangle of hyperfunction, hyperactivity, and pushing through trying to make the body work. What does this tell me? When people suffer from chronic fatigue syndrome, they think they have no more energy, they lost all of it. On the contrary, I would say they're actually using so much energy to try to do things, achieving nothing. And in fact, look what's happening. For each of the clients that I showed you that are all on the bottom right corner presenting symptoms of hyperactivity, hyperfunction, pushing through the day, they all have imbalances in other areas. So this client has dryness, tension, and stagnation of the fluids, meaning that the circulation doesn't work. It creates tension between the tissues, and most of the tension have lost function because they are dry, not enough lubricated. Of course, there is also signs of hyperactivity, pain, and hyperfunction because you're pushing through and these tissues are not responding. And you can see that the pattern repeats for all the possible clients. The second point is read the cause of pain from visible signs on your body. So we do external observation. We look if you're dry, if your skin is clammy, if it's pale, if you have swellings, if you have muscular tension. We look for and ask you for internal observation. Have you got nausea? Have you been vomiting? Have you got an hangover feeling? Do you feel bloated? Do you have mental tension? And so on. Each observation, internal or external, teaches us about the state of your fluids. For each state of the fluids, there is a dedicated therapeutic approach that you can use. The therapy is clear when seen this way for chronic fatigue syndrome symptoms. It can be assessed, developed, adapted, and refined, obviously, the more you practice with your clients. Recovery can be achieved following the natural improvement stimulated in the body. So finally, here we go with my 3-step solution that I want to show you. If the conventional treatment was doing this, increasing the toxicity of the fluid, here is what happened instead with the natural therapy. In the natural therapy, you can see that we start probably from a muddy situation, but the more the time passes, the fluids get clearer and clearer and clearer until your waters become the one of the swimmer swimming in fresh, clear waters at the right temperature. So our 3-step mission is recovery from pain is possible if you move from A to B. So your current state A is high intensity pain, or it could be low intensity pain, diffused, whichever it is, you are on state A. And you want to reach the next U, which is point B, low intensity, diffused pain, or no more pain. So step 1 is apply immediate emergency oils and creams. Because oils and creams, they go through the skin, they get easily absorbed, and they reach the fluids of your body that lies just underneath the skin. So you use infused oils, you use creams made with herbs and tinctures or essential oils that are strategically going in an area where you have pain to bring immediate relief, reducing the pain intensity, which you need to continue your therapy. Step number 2, you use fast internal herbal remedies to bring pain relief with no side effects. And here it comes a very crucial point. Herbs, when ingested or absorbed into the body, they are non-toxic at the normal dosage. Therefore, they are treated like foods that enter in our body and can be easily eliminated. They don't produce the toxic waste as a chemical drug. They are natural plants designed to nudge our body to do something and then easily be eliminated as normal foods. So using them can give you the power of the nudging, which is very strong in the herbs, but without leaving a toxic waste, leaving a struggle and a strain to your body. Step number 3, diet improvements, which work on the long term, together with long-term herbal remedies to build up basically what you lost while you were suffering from chronic fatigue syndrome. So nourishing your tissues, nourishing your fluid, giving a mineralization to the fluids, and bringing back the function. So warm you up if you've been experiencing deep cold, or cool you if you're really heated in your suffering from chronic fatigue syndrome. It depends, it has to be adapted, But the step 1, 2, and 3 are about immediate emergency to reduce the pain. Second, immediate emergency remedies to take internally to try to defeat the pain with no side effects. And the third is to work over the long term with specific detoxifying and nourishing remedies or with adjustment to the diet. So an example is that as a step 1, you could apply liniment made of castor oil and Gelsemium lobelia tinctures where your joints are in pain or your muscles. Those are two powerful herbs, Gelsemium lobelia, to respectively reduce the pain and relax the muscle to allow the oil to go through and make its gentle action. Second, you will use painkillers, for example, when you go to bed, that you want to pass the night resting, so you take the painkiller, you rest over the night, and you improve considerably your sleep quality. Or you can use circulation stimulants, or they give you anti-inflammatory support to, again, reduce the level of pain caused by the problems in the tissues. As a long-term example, you could use an increased amount of fiber in your diet to promote elimination. And maybe you could choose certain types of food that allow you to increase the activity of the liver to avoid the toxicity buildup. These 3 steps are just an example of how many variations you could do in this type of natural therapy to resolve the problem of pain. So, you are at your computer watching this presentation, you've heard how this works, the 3 steps to reduce pain, and you could agree that what I just showed you is the tested system with excellent results, already achieved with many different persons. It is natural, safe, an approach that does not burden your fluids with further toxin. It's a simple, clear therapeutic approach that is easy to understand and to implement. So what I would like you to do next is book our free pain and body assessment call. I've made available in my schedule a number of monthly free calls. They're all 30 minutes each. You can book one at the time that best suits you until they are available. All the calls are free. Why a call? You will be able to run our body assessment tests so that you can have a clear idea of what is going on in your body. You will be able to discuss these results live with me so that you can have straight away the key explanation of what the test means for you. You will be able to discuss in depth the issues that are concerning you so that you can finally find real effective help. The call is private, dedicated time in which you can ask questions and discuss in depth the issues that have been bothering you since a long time. We will go through your medical history, different tests that you might have done, the current medication, so you can rest assured the important checks are all in place before learning about a recovery strategy and everything can make sense for you. So click the link below this video and book your time now to ensure you have a place and start improving as soon as possible. If you've been struggling to recover from pain since a long time, and you want to be able to get a picture of how your body could ever do so, if you have not yet managed to rationalize the problem you're experiencing, you want each piece of the puzzle in its place to stress less about the gravity or nature of your condition, if you want to explore how herbs can be matched to your specific issues and which dietary patterns will support you more from where you are now, then this call is for you. Don't leave it too long, as waiting will only make things worse. Be mindful, I can take only 3 calls each week as I want to provide this as a free service, but I have a clinic to run. So click the link below the video to choose the best time for you. Thank you.